Dry eye syndrome occurs when your tears fail to adequately lubricate and moisturize the eye's surface. Normally, tears help maintain moisture on the eye's surface and flush away dust, debris, and microorganisms that could damage the cornea and cause eye infections. While dry eye syndrome can affect individuals of any age and health status, it is more frequently observed in older adults. It also tends to be more common in women than in men. Under normal conditions, eyes are coated with a fluid known as tear film, which prevents dryness and supports clear vision. The tear film is comprised of 3 primary layers: an outer oily layer, a middle watery layer, and an inner mucus-like layer, each produced by different glands around the eye. The meibomian glands in the eyelids generate the oily layer. The lacrimal glands, located behind the upper eyelid's outer edges, produce the watery layer, while the mucus-like layer is produced by goblet cells. Dry eye syndrome can arise if any of these components malfunction. If the meibomian glands become blocked, the oily part of the tears cannot be released. This might stem from eyelid inflammation or skin conditions. Alternatively, inadequate production of the watery component by the lacrimal glands can leave the eyes under-lubricated. There are several factors that can increase the risk of developing dry eye syndrome. These include the use of certain medications such as antihistamines, decongestants, birth control pills, some sleep aids, and hypertension drugs. Specific medical conditions like thyroid issues, diabetes, vitamin A deficiency, and lupus are also known to contribute to the syndrome. Environmental conditions such as exposure to sun, wind, dry air, and arid climates can exacerbate dryness, especially during activities that reduce blinking frequency like staring at computer screens, reading, or driving. Additionally, diseases such as HIV, Bell's palsy, and shingles may increase susceptibility to dry eyes, as can aging, allergies, and procedures like laser eye surgery. Symptoms of dry eye syndrome can vary widely but often include eye redness, a burning feeling, and sensations of dryness and soreness. Those affected might also experience discomfort while wearing contact lenses, increased sensitivity to light, and blurred vision. Home remedies for dry eyes. Number 1. The first and best natural remedy for dry eyes is omega-3 fatty acids. It is proven by research to not only enhance tear production but also to reduce tear film evaporation and alleviate dry eye. These polyunsaturated fats are crucial for human health. They are labeled essential because our bodies cannot produce them independently, necessitating their intake through our diet. Omega-3s come in 3 primary forms: EPA, DHA and ALA. Typically, if you examine the label of an omega-3 supplement bottle, you'll find at least 2 of these listed, usually EPA and DHA. ALA is found in plant sources like ground flaxseed and walnuts, whereas EPA and DHA are primarily found in fatty fish like salmon and mackerel. Omega-3s are effective in reducing inflammation, which boosts tear production. It also enhances the quality of secretions from the meibomian glands in the eyelids, leading to improved dry eye symptoms. Most of your tears are produced by the lacrimal glands located above and to the side of each eye, and omega-3s help reduce inflammation in these glands, allowing them to generate more tears. They also decrease inflammatory markers within the tears themselves. Meanwhile, the meibomian glands produce a thin oil layer that mixes with your tear film to prevent rapid evaporation. When these glands are inflamed, the oil can become thick and cloudy, and the glands may cease oil production, causing quick tear evaporation. Research shows that omega-3s improve the flow and clarity of meibomian gland secretions, thus enhancing oil production and preventing tear film evaporation. Additionally, there is some evidence from animal studies that omega-3s might aid in the regeneration of corneal nerves, which are essential for repairing damaged eye surface cells due to dry eye. For those who do not enjoy fish, omega-3 supplements are a popular alternative. Research generally supports a daily intake of about 1,000 mg of omega-3 for dry eye, with some studies suggesting that up to 2,000 mg may be more effective. On supplement labels, you will likely see EPA and DHA indicated separately. Both are beneficial for the eyes, though EPA may be slightly superior for dry eye management, and DHA more beneficial for retinal health. Omega-3 supplements are available in two forms, triglyceride and ethyl ester. The body absorbs the triglyceride form more naturally, whereas the ethyl ester form requires processing with ethanol. If possible, opt for a triglyceride form of omega-3 supplement, as it tends to be better absorbed and is less likely to cause digestive disturbances like fishy burps or upset stomachs. Number 2. Preservative-free artificial tears. Another remedy you can try at home, which you may have already considered, is the use of artificial tears. I specifically recommend preservative-free artificial tears, as these avoid exposing your eyes to certain preservatives that could cause sensitivity. You can safely use these preservative-free tears more frequently if necessary, without harming your eyes. The secret to their effectiveness is consistency. Ideally, you should apply them before your eyes reach a state of blurriness or dryness. Not only do artificial tears supplement your natural tear film, enhancing your vision, but they also coat the eye's surface. This coating helps prevent the formation of dry patches and wards off conditions like keratitis, or inflammation of the cornea. So, using artificial tears is a proactive measure to prevent your condition from worsening later in the day or evening. You're preventing your eyes from progressing along the dry eye symptoms. Number 3. Warm compresses. Warm compresses are a simple yet effective remedy for dry eyes. They work by gently heating the eyelids, which helps unclog the meibomian glands. These glands produce the essential oils that form the top layer of the tear film, crucial for preventing tear evaporation. When these glands are blocked, it can lead to increased tear evaporation and dry eye symptoms. Applying a warm compress improves the flow of oils, ensuring a healthier and more stable tear film. This not only alleviates the discomfort of dry eyes but also promotes overall eye health by maintaining proper lubrication. Number 4. Eye exercises. Two effective exercises to help mitigate these symptoms are frequent blinking and the 20-20-20 rule, especially useful for those who spend long hours in front of digital screens. Blinking is an automatic eye process that helps maintain eye health by ensuring adequate moisture levels. Each blink spreads tears evenly across the surface of the eyes, which helps to protect them from irritants and prevents dryness. However, focusing on screens for extended periods can significantly reduce the blink rate, leading to a higher incidence of dry eye symptoms. This phenomenon is often referred to as computer vision syndrome, or digital eye strain. To combat this, making a conscious effort to blink more frequently can be very beneficial. Ideally, a person should blink about 15 to 20 times per minute. Regular, deliberate blinking helps to refresh the eye's surface regularly, promoting better tear distribution and reducing the evaporation rate of the tears. This simple habit can provide immediate and comfortable relief from dry eyes. Another effective strategy to relieve and prevent dry eyes is the 20-20-20 rule. This exercise is designed to reduce eye strain caused by prolonged focus on near objects, such as computer screens or books. The principle is simple. For every 20 minutes spent looking at a screen, you should look at something 20 feet away for at least 20 seconds. This practice helps to reset the focus of the eyes and stimulates blinking, which refreshes the eyes. The 20-20-20 rule not only combats the stiffness of the ciliary muscles, responsible for changing the lens shape for focusing, but also encourages consistent blinking. This decreases the strain on the ocular surface by improving the moisture levels and reducing the load on the tear film. Regularly practicing this rule throughout the day can help to maintain optimal eye health and function. Integrating these 4 home remedies into your daily routine is straightforward. Start by adjusting your diet to include more omega-3 fatty acids. Use warm compresses regularly, perhaps in the morning or before bed. Opt for preservative-free tears when you feel discomfort, and remember to exercise your eyes throughout the day, especially during long periods of screen use. Give these tips a try and see which ones bring the most relief to your daily life. Remember, consistent care is key to maintaining healthy, comfortable vision. Thanks for watching, and leave a comment if you have experienced dry eyes yourself. Have you tried these home remedies already?